All right, we're going to give it about 30 seconds to let people join in on this live Facebook Live virtual town hall. Hello, I'm Colonel Michael Greenberg, the Fort Belvoir Garrison Commander. Good evening, everyone. Thank you for joining us for this week's Facebook Live Town Hall. Today I'm joined by Captain Judy, the Director of the Fort Belvoir Community Hospital, along with some subject matter experts that I have in the room. And today we're going to update you and answer your questions on how we're continuing measures to take care of this community and to reduce the spread of COVID-19. I hope these weekly town halls have been useful. I've heard some feedback and I believe people are liking them and we're getting the information out. So we will continue to do these as needed or periodically once a week. Just to give you a recap at last week's town hall, what we discussed. So first we discussed about the face covering policy that was released by the Secretary of Defense on April 5th. And again, if you remember, the policy basically stated on DoD installations, if you could not maintain a 6-foot distance, then face coverings were required. We also talked about Lieber gate closing and Tully gate opening with the new 24-hour gates. That transition happened. Again, the Tully gate will remain open along with Pence and Farrar until otherwise stated. Social distancing protocols were put into place at the commissary. Again, we announced last week, effective on 10 April, the commissary leadership had put out a face mask policy that mandated all patrons and those working in the commissary must wear their face coverings. And then we provided an update from the hospital and addressed your questions. So again, I want to take this opportunity just to thank the workforce, first responders, service members, civilians, and contractors, all who are on the front lines coming to work every day and ensuring our people are taken care of, from the hospital to our child development center employees, to all the contractors, our guards, again, firefighters, police, and all those that are keeping this installation operational. So thank you very much for what you're doing. I'm so very proud of the resilient workforce, mission partners, and community. Thank you again for continuing to abide by the social distancing protocols and efforts that we've been put into place. This is truly an all-together effort. So where are we now? So in today's town hall, I'm going to address 4 areas. First, I'm going to talk about the Garrison's new face covering policy. Second, just discuss about the reopening of our child development centers. Allow Captain Judy to talk a little bit about the hospital efforts. And then myself, our subject matter experts in the hospital, will address questions that have come up since the last town hall that you've published on Facebook. So first on face coverings. So effective tomorrow, the face covering policy that I issued last Monday is in effect. And this requirement is to enforce the wear of protective face coverings in all areas where social distancing cannot take place. Specifically, those areas are the commissary, which already has a policy, the post exchange, shop-ets, post offices, ID card offices, child development centers, the hospital, food areas. So again, all those areas that you cannot maintain that social distancing, those face coverings will be required. And first and foremost, this policy is to support my number one priority, which is maintaining a safe environment on the installation, and it aligns with the DoD policy. I ask coworkers, neighbors, service members, parents, family members, veterans, each of you do your part to support a safe and healthy environment for all. Again, the face coverings is not necessarily to protect yourself. The face coverings are really to protect the community at large. So again, I don't want to jeopardize the health and safety of the community. There has been signage up over the last couple of days. There has been questions that have come up. Why wasn't the policy in effect on Monday? Again, great questions, but there's rationale to what we do. Again, we want to make sure the face policy got out to the community at large. What have we done since Monday? So we've announced it on social media multiple times. We've put signage up in the facilities that would be affected. We've put signs up at the gate as well. And we continue to tell folks around the community that this policy is in effect tomorrow. And so what does that mean tomorrow? So that means tomorrow the policy is in effect and it will be enforced. Okay, and so please don't get your feelings hurt if you're not helped at an area that requires a face covering. Okay, I'm telling you that's going to happen. So please, we put it out all week. The face coverings are required at those facilities. Those cashiers and those employees at each of those those facilities have been instructed that if you do not have a face covering, that they will not sell whatever products or services that they are providing for you. The only exception to this is as you go into the post-exchange facilities, you will be allowed to go into the facilities, the post-exchange, buy your face covering before shopping and pay for it, and then you can shop at the post-exchange with a face covering. Again, we will have folks, to include myself and other leadership, going out to make sure that that policy is enforced. I ask if you see something, say something. Okay, and again, if you're one of those who don't want to put a face covering on, then I ask you to remain at your house or remain off the installation. Again, that policy is to ensure that our residents and our community is protected. We have reopened our Child Development Center. This week we had multiple children in a Child Development Center. We have added additional protective measures for both the children and the staff. Children 3 years and older are required to wear face coverings, and Child Development Center employees are also wearing face coverings and masks, and having all the proper procedures put into place. We continue to have the public health assessments done not just at the Child Development Centers, but every week the hospital is supported going out to each of the facilities and ensuring that we continue to enforce what the standards are, or what CDC has put out as standards, and then standards that we have put out. So again, that is happening weekly. The next thing I want to talk about is the area that people have had questions about, and it's in the 500 area, which is one of the areas going into one of the villages. So the Garrison has established an area. We've leveraged the IHG facility to support housing of quarantine and isolated occupants. This was in direct coordination and partnership with the hospital. We work extremely hard between the hospital and us, IHG, and we have a task force set up. One of our units, our engineer battalions, take ownership of helping us with the mayor's cell in setting up that facilities. But let me be clear that this is not a hospital facilities. We are not treating patients in that facility. And again, I want to make sure we're clear on that. Let me also be clear that we're not just haphazardly putting folks in that facility either. And so those occupants that are being put in the facility are going to the COVID clinic. They're being screened by the hospital, and only if they when they're released from the COVID clinic, only if they are potentially a barracks individual or an individual that has a high risk individual at their house, or in a circumstance where they don't have access to a single bedroom with a unshared bathroom. At that point, the hospital then will screen them and then push them over to the Garrison, which then will occupy into that facilities. So again, it's no different than if you are a positive COVID, or you're in a quarantine situation and you go back to your house and you stay in your bedroom and your bathroom. It is no different. And so there's been questions whether, can I walk past the facilities or can I drive past them? The answer is absolutely yes. And again, the hospital director could correct me if I'm wrong, but there is no health safety issues with walking past those facilities. We have blocked off with some fencing, and that was more so children would not get into the facilities and start going and knocking on rooms or playing in the actual hotel room areas. And that is why we have restricted access to those areas. The occupants of the facilities have military management, security support, and we basically sustain their needs while they're in a restriction of movement. So we also have meals that they're able to access and other services, and so those occupants are not coming out and are not going off the site. They basically are maintained in those rooms until they're released to go back home. And then the last thing I want to talk about before I turn it over to Capt and Judy is, in the interest of safety this week, we did inform the community that MDW would position some aircraft on the parade field. Okay, that did happen. We do have 2 aircraft on the field. We thank you for staying away from that area. It is not for public display, and for safety precautions, we ask you to continue to remain 100 feet away from the areas that the aircraft are parked. Now I'll turn it over to Capt and Judy so she can provide you some updates.
Hey, thanks, Colonel Greenberg. I want to start off by just saying thank you. Once again, there are a lot of people and groups doing things for others, whether it's sewing face coverings or going grocery shopping or watching someone's child so that they can get health care. The community is really, really doing a lot to support one another through this, and I recognize that. But specifically for the hospital, I want to give a few thank yous, and that's the USO, the Red Cross, and then one of the Fort Belvoir community neighborhoods. They've donated face coverings for staff, patients, and visitors, as well as meals and snacks for our healthcare workers. And I just want to extend a big thank you from all of the healthcare workers for your generosity. They really appreciate it. In addition to protecting our forces and families and the community, we are deeply committed to protecting the mission. It is a priority. And so my special guest today is Major Green. I've brought Major Green with me to talk about some of the things that are going on at the hospital to ensure that we can still deliver readiness, ready medical force and medically ready forces.
Yes, ma'am. Thank you, ma'am. Sir, good evening, everyone. I'm Major Kelly Green. I am the Chief of the Medical Readiness Department, and I'm here to go over some of the exams that we're still conducting and how you can go about getting those completed. So first I'll touch about PHAs. These are 100% virtually done right now. So you complete the self-assessment like you normally do online, and then call 571-231-7334, and option 2 will take you to the front desk and you can schedule your appointment. If you've been putting this off or you haven't had it done in a while, right now it's a great opportunity to get this done virtually. I'm also going to talk about separation history and physical examinations, also known as SHPEs. So if these cannot be delayed, we are still completing them. However, in accordance with HQDA guidance, we're not doing the physical exam portion, so the hands-on portion. So these are being done virtually as well. The Joint Medical Readiness Center, we do the National Guard and Reserves that have been on orders for 180 days, and so that will be done virtually. And primary care will do your retirement physical also virtually, unless for some reason you need to come in and have your physical exam done. Pre and post deployment health assessments are conducted as usual. Navy suitability, overseas screening for Army, and school exams are being done on a case-by-case basis. And you can call, again, the Joint Medical Readiness Center. It's 571-231-7334, option 2, to talk with the front desk to talk about your specific situation. Some other things, routine annual hearing exams and vision exams have been postponed until further notice, unless it's to complete a mission essential exam, so it's required to complete an exam or a physical. And also, just for expectation management, our 8-man booth in audiology is currently running one person at a time to maintain the social distancing. So if you can postpone your hearing exam, we recommend to do that right now. Touching on flight physicals, USAMA published some guidelines that the initial flight physicals will be delayed until further notice, unless it's for a deployment, a mobilization, or for a school that it's required for. Some flight services are being offered virtual. If you're in your window to recertify your flight physical, or you have questions or concerns, contact the flight team in the Joint Medical Readiness Center at the number previously mentioned. Also, for Navy and Marines, there's been a 4-month grace period for physicals such as flight, dive, naval special warfare, special operations, submarine status. And so you're due between March 2020 and June 2020. There's a 4-month grace period from the time that your exam, from the time of your current exam. Lastly, the Medical Readiness Center is heavily relying on secure messaging. So if you aren't already enrolled, we highly encourage you to go to TRICARE Online and enroll in secure messaging. We're using that to make sure that you understand the requirements for the exams before you come in for your Part 2 exam. Some of these exams are very in-depth, and we want to make sure that when you come in that the exam will be completed. Again, if you have questions, the Joint Medical Readiness Center number is 571-231-7334, option 2, and we can answer any of your questions. Thank you, ma'am.
All right, thanks, Major Green. It's actually a really great time to get some of your readiness stuff done. The addition of the virtual appointments has really helped us get our readiness numbers up throughout the base. So if you are somebody who is teleworking, or you have a little bit of extra time in your day, it's the perfect time to really address some of those readiness healthcare needs. Another thing I wanted to talk about, Colonel Greenberg talked a lot about the face covering policy that's going into effect tomorrow. Obviously, face coverings are required at the hospital too, but we're not going to turn patients away. We'll just provide a mask. But what I'm asking is people be mindful of that I don't want the hospital to become the primary source of masks for people when they don't have a face covering. I need those masks for our healthcare workers. So please do your best to come up with an option for getting a face covering prior to coming to the hospital. But we're certainly not going to turn anyone away. I had a couple of questions that I wanted to address from the last town hall and some of the Facebook posts that we've seen. One of them is Fort Belvoir Community Hospital providing PPE for all of their employees, or do they have a shortage like many other hospitals in our area? And we do have sufficient personal protective equipment right now to safely care for our patients and to protect our staff. We're closely monitoring the utilization rates of key items, and it varies depending on the number of patients that we have at any given time. But obviously, we're really closely monitoring those gloves, the masks, the gowns, and the face shields that you see a lot of posts on social media about just across the nation. One of the great benefits of being part of a healthcare network, though, is that when we experience delays in receiving orders specifically for Fort Belvoir, we can cross-level or share stock with other facilities in the National Capital Region, and we've done that some between the Pentagon, Walter Reed, Fort Belvoir, Quantico, and some of those places. And so we've not run out. We're doing okay, and so I want patients to know that they can come safely to the hospital to get their care, and the staff to know that we have plenty to make sure that they're protected as well. Another question that I received was, are retirees and family members still going to be treated at the hospital? And the answer is absolutely yes. We are not turning away or limiting services to any beneficiary group at this time. We remain committed to serving all of our beneficiaries. The only time that we would not provide care for you is if for some reason it exceeded our scope or the capacity of the hospital at that time. And then what we would do is we would transfer you, for example, to Walter Reed as our local military tertiary care facility, or to one of the local network hospitals, whichever is safer for that patient to go to at that time. But we are still caring for all beneficiary types at the hospital. The next question was, are labor and delivery patients restricted from walking during active labor? And the answer is, if you're clinically stable to be up during labor, you can walk around your room. You're limited to your room. The rooms are fairly big in size, and so you can walk around the room. Unfortunately, right now, you can't walk up and down the passageways like you might have been able to in the past. And that's just for everyone's protection. It's for the patient, their significant other that's with them, and for the staff. There was a comment that it's unreasonable to expect laboring patients to wear a mask while in labor. I completely understand. I just want you to know that the mask is necessary to protect patients and staff when both are in the room. But when the staff member leaves the room in between some of those checks and the things that are going on during labor, you can remove that mask and continue to labor without that mask. It's only required when everyone is in the room together. So it's not the entire time you're in labor. It's during those exams and so on. And then finally, there was a question, are there plans for a drive-up pharmacy? And I know that we had somebody here last week to talk about pharmacy, but I'm just pleased to announce that tomorrow, starting at 07:30, we're going to go ahead and open up the pharmacy services. I'm actually going to hold this up so people can see this image, whatever we want to call it. This is what I want you to look for on the Facebook page for Fort Belvoir Community Hospital. I'm sure Fort Belvoir will share it as well. And then also on our web page. If you look for this little icon and click on it, it will give you all of the information on how you can activate your prescription and then what you need to do to utilize that curbside pharmacy service. So rather than give you all of the details about it and expect you to write it down, just look for the little purple one with the car and the drive-up pharmacy picture. Just some details about the drive-up pharmacy services. The hours will be from 07:30 to 17:30, Monday through Friday. It will not be open on Saturday. I want people to know that's generally because the volume on Saturdays doesn't really support having it open, and we can safely continue to social distance and have people come in on Saturdays to the pharmacy. The entire pharmacy team has been working really hard over the last few weeks to make this experience as seamless as possible. It's all about promotion of social distancing and your convenience. So for your protection and our staff's protection, we're still asking you, because you're going to be at the window at the car, to please still wear your face covering when you drive up to meet the staff and to receive your prescriptions. You have several options to activate your prescription. I'm not going to go into detail about that, but what I'm going to say is there's two ways that you can do curbside pharmacy. If you don't activate your prescription in advance, then it takes 2 trips, right? One to come up and do that activation at the curb, and then another return visit later on to pick up those prescriptions. But by clicking on the icon again, showing it to you again, right? If you activate that prescription prior to coming in, then it will be ready for your pickup when you come later, and it will only be 1 trip to get those prescriptions. If you have any questions or you want the phone number to activate that prescription, it's the same phone number I think that Major Green was just giving out. It's the hospital main number, 571-231-3224, and that will be option 2 and then option 2. So the first option 2 is for pharmacy. The second option 2 is to go through the process of activating those prescriptions. So those are the updates from the hospital.
All right, thank you so much. A couple more points I want to put out before we have subject matter experts come in and answer some of the other questions. And so first, for the face coverings, again, make sure that you're wearing them correctly. Cover your nose and mouth. I've seen a couple, and I've done some battlefield circulations around the installation, and I'm proud to say about 80-90% of our folks are already wearing face coverings, but unfortunately, some of them are just, they have it on their mouth and not their nose. So please make sure you're wearing those correctly. Next, there's been questions about the commissary and the passive thermal temperature readers. There's been questions, whether it takes pictures or is saved or where they go. Okay, I want to dispel any rumors. Those are not cameras. Okay, those are passive thermal temperature readers. There are no SD cards in there. Those devices are looking at the core of your eyes and giving a core temperature. Okay, and there are signs that indicate that as well. If you do have a higher temperature with the thermal reader, we also have the IR non-touch contact thermometers at the commissary as well, and we'll take your temperature with a secondary measure. If you still have a high temperature, we're going to recommend that you go seek medical advice from the hospital. We also have set up, effective yesterday, a single point of entry into the main exchange facilities. And so, again, apologize for any inconveniences. So if you are trying to go to the pharmacy, or you're trying to go to the food court, the post-exchange pharmacy, or the post-exchange food court, you do need to enter through the main exchange doors. We do have screeners there that are asking questions. They're also going to make sure people understand the face covering policy. If you are, and we have the same thing at the commissary, but what would I demand from you is that you do not take any anxieties out on any of the screeners. And so if you don't want to wear a face covering, don't tell the screeners anything bad, okay? It's not them, it's myself who's put out the policy letter. They are just advising you on what that policy is. If you have challenges with that, you could either come talk to me and my staff. Also, the facility managers are out there enforcing the standards as well. You can talk to one of them if you have challenges. But again, my directive out there is face coverings in all those facilities. Please do not, just like the security guards at the front of our installation, those screeners at the two facilities are doing their job and they're taking orders. Please do not say anything negative or anything to that effect. Also, in our newspaper, again, in the top here, if you have questions about the policy, you can open up the newspaper and read that on the front page. Okay, I'm going to turn it over to Mr. Henschel to talk a little bit about installation access.
Thank you, sir. Sir, I think the first question that we had was in regard to installation access, and it was, with the DMV being closed, the Department of Homeland Security has announced there would be a further extension of the Real ID requirements. Would it be possible to reevaluate the requirement for Real IDs for visitor passes? Answer, Department of Homeland Security has extended the Real ID requirement to 1 October 2021. However, if you've renewed your driver's license recently and you did not opt for that Real ID compliant driver's license, the one that, if you got one that says not for federal use on it, we are still unable to accept this as a sole form of identification. So you'd need a secondary form of identification also, being something as a birth certificate or a passport. Sir?
All right, thank you. I'm going to have Mr. Rennick come up and talk to IDs and TRICARE.
Good afternoon all, Kevin Rennick, Director of Human Resources. Question that came up for this time call, for retiree dependents that are turning 65 in June and don't receive the Medicare card on time because Social Security offices have been closed and everything is taking longer, what is going to happen with our ID and TRICARE? That is a great question. First, it's a twofold question. Let me answer the first one as it pertains to the ID cards. The latest policy issued is that all ID cards issued on or before 1 January 2020 will be extended through 30 September 2020. So your ID card will not expire as long as you have it up until 30 September of 2020. As it pertains to the Medicare card, I did reach out to the Social Security Administrative Office. I was able to talk to someone. So I encourage you, if you're still trying to obtain your Medicare card, please call them, stay on the line until you speak with an individual, because they are able to process your application on the telephone. So let me provide you with a good phone number to reach them. 1-800-772-1213. Again, 1-800-772-1213. Thank you.
Great, thanks. Mr. Landgraf, come up. I'm going to talk commissaries as he's walking up here. So for the commissary, there was two questions. One, can we get uniform hours at the commissary? And I think what people are asking is, can we have some time frames where we have certain categories come to the commissary? We have already looked at that. I will tell you there is not going to be a uniform or retiree portion or a high-risk portion at the commissary. Please understand we have 1,500 people to 3,000 people patrons going through the commissary each day. Again, I ask you, it got a little better this last week, but I ask you to spread your shopping times. Instead of everyone going in the morning, try the afternoon or evening. Thanks for those who served me in the evening and said thanks for the tips, because the evening, again, was not as crowded as the morning. Again, assessing the commissary, they are continuing to have trucks that do come into the commissary. A lot of the areas that had shortages before, the trucks are coming in. So some of the pastas and meats, there is a whole lot of inventory there. Some of the items they're still having some challenges with now is toilet paper again. And I think that's the major one that the commissary manager said. And then some of the Lysols and some of the cleaning sprays. But again, the misnomer that if I miss the morning shopping, that the shelves will be empty, that is a false pretense. Okay, they are stocking shelves throughout the day, and so if you come in the afternoon or evening hours up to closing, those shelves will still be stocked with items. The second question was if we are trying to limit people contact, should baggers at the commissary be considered non-essential and pretty much not work? I would tell you the commissary has a very good logistical setup for operations. The baggers are just like any other part of the commissary to make the commissary run effectively. And if you noticed at the commissary, there are not as many baggers that are there normally, so they do have a reduced staffing of baggers. But again, those baggers are essential to the overall operation. To get 1,500 people in throughout a day or more on the weekends, it takes every part of the commissary to operate. We also have individuals who just can't bag. They just may not be able to do that. And so again, that service is essential to make the commissary work as effectively as it does. You do have options to, if you are concerned with the baggers, you have options to do a self-checkout area or to go to the cashier that does not have a bagger. Okay, I'll turn it over to Mr. Landgraf.
Good afternoon, sir. Chris Landgraf, Acting Director of Public Works. The question to Public Works today was, are maintenance personnel wearing protective gear? And the answer is yes. I've confirmed with both our housing partner and with our base ops contractor that they are issuing personal protective gear for the maintenance technicians, and they are wearing face coverings and gloves when they go into facilities. Thank you.
All right, great. So while Mr. Dixon comes up to the podium, let me talk about the exchange. And so there's a question, soldiers on Belvoir are required to maintain haircuts. If the PX barbers can take proper cleaning precautions, can we open the barbershop for limited hours to military personnel only? Even if we lock down, even though we are locked down, we are still expected to maintain professional military appearance. I understand those comments very, very wisely. I will tell you, we've already done public health assessments. Thank you, hospital, for providing a lot of the measures that we will implement when we do open the barbershop back up. That is under consideration. However, at this time, it will not open for several weeks. Again, I'm not going to give any timelines at this point. When it does open it up, we will start with active military first, with limited hours, using all the precautionary measures that were outlined by the hospital, and then we will open it up to the public as the situation continues on. Second question is, has the curbside pickup service started at Fort Belvoir? The answer is yes, it has. So you can go online, you can order your stuff. We are still working on some of the parking spot signage and markings. However, there is some designations in front of the post exchange facilities, and you can use that service now. One question that has not been raised yet, but I'm going to just announce next week the AFES exchange is working to open a personal shopper program. Again, more details will be on the website. This program is really set up for those who are in isolation and quarantine, who can't go to AFES to pick up some of the necessitated items that you need. And so the program would work essentially you would call into AAFES. You would do your shopping online. They would pay for it, or you would pay for it on via phone, and then the AAFES would coordinate with a representative to drop that off or to arrange the setup for a transfer of items. So again, more to follow. It probably at the beginning of next week. But I just want to put that out there that they are starting this personal shopping shopper program. Okay, Mr. Dixon, off to you.
Thank you, sir. First statement and question. Temperature checks at the commissary is a great idea. Could that also be a possibility for staff, parents, and children at the CDC? Yes. We are currently doing temperature checks at SAC and Joanne Blank CDC. Second statement and question. We have plans to go camping in June. Has anything been decided that far out yet? No, it has not. As of this date and time, we have not canceled any reservations in the month of June. We have canceled all reservations through the 31st of May. Third question. Can I take my boat out on the Potomac? It's at the marina on post. Yes, the launch ramp is open. As long as you have your key card to get into the gate, you're good to go.
All right, great. And then one more question from the exchange. Should fast food employees be wearing masks and gloves? And the answer is yes, they should, and they are wearing them. And so face coverings and gloves will be worn. The food employees also must maintain the washing of their hands. So you may see gloves off for washing of hands. But again, when they are preparing food, they are wearing all prescribed PPE. Again, these are all policies out there. If you see something, say something. Okay, and so again, your feedback is important to us. I think those are all the plan questions. Are there some out there from the audience?
Yes, sir. Will CYS provide refunds for spring sports?
Yes. The answer is yes. Again, if there are refund questions about anything that you have booked, whether it's the Officers Club, it's golf, it's spring sports, whatever those are, we'll offer full refunds for any of those activities.
Is the CYS care still only for mission kids?
The answer to that, so the question is the CYS services only for mission essential children? The answer is yes. And we've really called them vital families because, again, if the Child Development Center operations is one of our more risky operations. We've done a lot to protect the children and our employees out there, but however you look at that, it is still a pretty rigorous operation. And so we have asked our mission partners reverse standing things back up, triggered by decrease in health protection conditions. So as we move to a decreased health protection condition, that would trigger some of these activities like the Child Development Center, haircuts, bowling alley, golf course, all those activities that we had been doing, that will trigger those to begin to stand up with all those protective measures that we put into place.
For the hospital, is the vaccine clinic still open?
So, yes, sort of. So we are still giving vaccines. I think there was another question that was on there that was just, is the hospital taking in-person appointments with providers or only virtual appointments? So the vaccine clinic kind of goes hand in hand with that. So especially for children who are on those schedules for vaccinations, we want to maintain those schedules to the best of our ability to make sure that they get those. But with regards to the appointments to go along with that, we are still doing quite a bit of in-person care at the hospital. It's typically acute, urgent, and emergent care, or care that can't be deferred, or care that can't be accomplished by telemedicine. So yes, the vaccine services are reduced from what they used to be, but take my microphone back. They're reduced from what they used to be, but there's still enough vaccine services to support all of the care that's being delivered there.
Is the finance office still open?
And there you should have some names in which you can reach out and process the orders. We are prioritizing our orders based on report dates. And so therefore, we are working in concert with mission partners and the HR community as it pertains to the issuance of those orders so that those service members and soldiers can receive them. Thank you.
All right, great. So there's no more questions at this point. Again, you could find the recap of last week's town hall along with all the frequently asked questions from the previous town halls on our homepage at Fort Belvoir website. I'm going to turn it over to Captain Judy if you have any closing remarks.
Sir, I don't have any closing remarks. I think this is a great opportunity. I really love being able to talk with folks out there. I think that the questions that are asked are great questions, and we review all of them and look at the conversations that are going on. And I appreciate the respectful nature in which everybody treats one another, and the fact that we've got people who are answering questions for others when they know they've seen that someplace else. And so I'm really impressed with this community and appreciative of everyone taking the time to do that. So thanks.
Thank you. So just a couple points before we close. And again, thank you for listening to this virtual town hall. We will continue to do this weekly. Our next one will be next Thursday at 1700, unless something changes. So first, I said it at the first town hall that we did. Please only post accurate information on our site and on any site. We have had to go back and spend time and efforts to put out accurate information because there was an inaccurate posting. So again, if that information does not come from a credible source, I ask you to please keep your comments to yourself because you cause other folks to panic when there's no need to panic. And so just bottom line, so my number one priority during this health emergency is really to protect the community. We will continue to keep you updated on everything that we're doing to beat this virus. I appreciate all the feedback that you give us during the week. I appreciate those questions to prep Captain Judy and myself and all the other subject matter experts in the room. And hopefully we are answering your questions. Thank you for your participation in this town hall. A closed caption video will be posted on Facebook. Please continue to use Facebook and our website as a resource for the latest information. Stay safe. Please continue to use face coverings. We will be out in force tomorrow making sure that the community is truly using face coverings in all areas. Thank you for listening in. We look forward to the next update. Remember, social distancing saves lives, and we are all in this together. The longer we stay at home and apart, the sooner we'll be together. Thank you again, and have a great night.